Planet Dolan.
From a patient who shot his plastic surgeon to a man so frustrated with the healthcare system that he turns to murder, we count 8 chilling times patients killed their doctors. Hello there, my name is Shima and I'll be your feline narrator today, reading out amazing and unbelievable facts while you get nice and cozy. Number 8. If you believe bad things don't happen to good people, this gruesome 2006 murder will change your mind. David Cornbleet was a charitable dermatologist known for his good deeds, like treating 9/11 burn victims and helping those affected by Hurricane Katrina. Exactly the sort of person who doesn't deserve to be brutally stabbed to death 20 times. A surveillance camera happened to capture footage of the perpetrator, but the person's identity was unclear. It took some MySpace detective work, an anonymous tip, and a year-long manhunt to solve the mystery. It turned out the killer, Hans Petersen, was one of David's patients from 5 years earlier. He'd planned to torture David, but ended up stabbing him during the struggle. Number 7. It seems even internationally respected doctors who are pioneers in their field have to deal with disgruntled patients. Unfortunately for Dr. John Kemmink, this disgruntled patient was driven by a powerful delusion that drove him to murder. In 1992, Chester Posby got it in his head that Dr. Kemmink was conspiring to perform a deadly brain operation on him. Feeling betrayed, he burst into the University of Michigan Otolaryngology Clinic and shot Dr. Kemmink in the head, shoulder, and abdomen with a semi-automatic handgun. Dr. Kemmink was known for his pioneering work developing cochlear implants for children, which have improved thousands of deaf and hard-of-hearing children's lives. Number 6. Psychiatrist Wayne Fenton probably didn't consider his unarmed, mild-mannered 19-year-old patient a threat when he showed up for his regular appointment in 2006. No one could have foreseen that young Vitaly Davyudov would snap into a schizophrenic rage and pummel his doctor to death with his bare fists. The horrifying, unprovoked murder occurred during a discussion of Vitaly's treatment options, and wasn't noticed until Vitaly's father came to pick him up. He saw the bloodstains on his son's hands and clothes and immediately dialed 911. Vitaly confessed and was found guilty, but was not held criminally responsible because of his condition. He was moved to the maximum security mental hospital in Maryland where, 4 years later, he tragically murdered his roommate. Number 5. If asked whether you'd prefer to die or live with a difficult disability, most people would choose life. But for 72-year-old Wilfredo Saban-Solin, living just didn't seem worth it after he lost the ability to walk. After life-saving spinal cord surgery, Wilfredo ended up confined to a wheelchair. He'd been an avid runner for most of his life and couldn't cope with losing that part of his identity. The surgeon who performed the operation, Dr. Chris Cecil Abu, had allegedly reassured him that he would be able to walk properly after therapy. So when Wilfredo ended up stuck in a wheelchair, he vowed to kill the one person he held responsible. Slipping past hospital security, he fatally shot the doctor twice in the chest, and then took his own life. Number 4. If you ask most people what they take for granted in life, you could probably expect answers like time, clean air, or maybe their loved ones. What you wouldn't expect to hear is bowel control, but that's something former barber Stanwood Elkis struggled to live without. After undergoing prostate surgery in the 90s, Stanwood was forced to hand in his dignity card and adjust to life as an incontinence sufferer. He eventually came to accept it until a 2013 conversation with a friend put a dangerous thought in his head. The friend told him the urologist who performed the procedure, Dr. Ronald Gilbert, had botched it and was the reason Stanwood's incontinence was so severe. Furious, Stanwood showed up at Dr. Gilbert's office the next day and shot him 9 times in the torso, killing him instantly. Afterwards, Stanwood staggered out of the examination room and said, "Call the police, I'm insane." The cops arrived 8 minutes later to arrest him. Sadly, the shooting may have been a case of mistaken identity. Dr. Gilbert had worked at the hospital at the time of Stanwood's operation, but no records suggest he participated in the surgery. Number 3. Although psychiatry helps millions of people every year, not everyone can be saved. In 2011, 62-year-old paranoid schizophrenic Barbara Newman shot her psychiatrist Mark Lawrence in his Maryland home. A day earlier, Mark had voiced his concerns about Barbara to a colleague. Barbara had begun blaming all of her problems on Mark, so the colleague advised him to send her for an outside consultation. Unfortunately, Barbara's disturbed delusions escalated before there was time to put this plan into motion. She took Mark's life before immediately turning the gun on herself. Number 2. Everyone has days where they wake up feeling unhappy about the way they look. For Yuri Lebedev, this was every day of his life. No matter what he did, he was never satisfied with his appearance. Eventually, he resorted to invasive plastic surgeries, but even these failed to improve his horrible self-image. The doctor who oversaw Yuri's surgeries, Dr. Alexander Remezov, warned him that getting further surgeries would be a dangerous road to go down and would not make him happy. He advised Yuri to see a psychiatrist, but his words fell on deaf ears. Yuri blamed the doctor for his self-esteem issues and, in 2015, entered the Russian Railways hospital in St. Petersburg with a concealed machine gun. He found Dr. Alexander's office and shot him in the chest, then tragically took his own life as well. Number 1. Sometimes, grief can push a person into dark territory, like in 2015, when confused 55-year-old Stephen Passeri shot and killed Dr. Michael Davidson because he blamed him for the recent death of his mother. Stephen was overcome with anger and deeply frustrated with the U.S. healthcare system. He'd been extremely critical of the system and the media ever since his father unexpectedly died during a short hospital stay in 2011. Stephen's elderly mother died because of unforeseen complications in her treatment, but Stephen still held Dr. Davidson personally responsible. He shot the cardiovascular surgeon twice outside his office before committing suicide. Dr. Davidson left behind 3 children and a pregnant wife. A tragedy all around. Thank you all for listening, even if it wasn't the cheeriest of subjects. I wish all of you the best of days. Goodbye. Witnesses say they saw Lewis climb over a fence and assault a neighbor, then hop back over and return to the Davis house. He later fell from a roof and died. Although he had a history of drug use, autopsies revealed that Lewis had no drugs or alcohol in his system at the time of his death.